All right, so I'm just going to follow up on a video that I posted the other day regarding the, new grad nurses without a job. And I'm going to be very careful here because it's a sensitive topic. This is not an attack on international nurses, but it is about patient care. It's about the reality of a lot of Jamaicans. So we keep hearing that Jamaica needs experienced nurses, so the government, they resort to international nurses and they bring them in. But what nobody talks about is the language and the communication barrier that comes with it. And in nursing, we know that communication is key. Communication is everything, because you can have a clinical skilled nurse. You can have a nurse with years of experience. But if a patient can't fully explain their pain to you, or you understand what they're saying, then we already know that care is already compromised. Many Jamaicans don't speak textbook English when they're sick. They speak patois, they speak emotionally, and when it comes on to their symptoms, they describe it culturally. So a local nurse will understand exactly what a patient is saying in Jamaica when they say, "My head a bust me, my chest feel heavy, me eye my heart me." Yes, we know exactly what it means. We don't need a translator. We don't need any extra explanation. We don't need anybody to say, okay, then this is exactly what the patient is saying. And this is not something that you learn in the classroom. That's lived experience. So what happens when you have these nurses coming in, when you have international nurses, or what happens with the language barrier is that you have the local nurses, they end up translating, they end up explaining, fixing misunderstanding. And that is just additional pressure. That is just additional work for the nurses who are already stretched thin. So patients get frustrated, the nurses get frustrated to the point where sometimes they feel as though they want to quit or they just leave. You understand? And the care slows down for a lot of patients. And the irony of this is that while everything is happening, you have your new graduate Jamaican nurses, they're home unemployed. Nurses who already understand the language, the culture, the patient, the system, they're home. Yes, we're talking about the new grads. They need guidance, they need mentorship, but language and cultural competence, them already have it. They already have it. And that is what matters. Because nursing is not just about giving medications, doing tasks, let's just say. Nursing is communication. It's trust. It is understanding someone on their worst day. And that is it. So when we talk about fixing Jamaica shortage or nursing shortage, we can't just talk about numbers. We can't look at numbers only. We have to look at the quality of care. Look at the quality of care for these patients, and then from there. Experience without communication is not enough. And until Jamaica starts valuing and supporting, or properly supporting its own new nurses, this cycle is just going to continue. It's just going to continue. What I would love for is if the government can think about the same package that they're offering to international nurses, if they could gather all of these new grads who are ready and say, okay, then this is what we have to offer. It might not include benefits, insurance, all of those things. It might not include it. But are you able to settle for this until the right time, position become available, or the government, the budget is able to cover all of the necessary things that a full-time or temporary permanent nurse would have been able to get? Are you able to settle for this? And if they offer this to the nurses, the new graduates, at least these new graduates will be getting experience. They'll be building on their skills, their competence, and will be able to better serve the Jamaican community years later on, because they would have started building on their experience. You understand? So the government wouldn't be relying on international nurses when they already have nurses in the country that they can train. You understand? Persons will be there to help them out on the floor. Because just like these international nurses, who some of them don't understand much of the language or they don't understand the culture, these same nurses on the floor have to be explaining to them the same thing. So why not have these same nurses explain to the Jamaican new nurses them when they get on the floor? Let me know what your thoughts on this are, but this is just how I feel about the situation. And as I said, this is not an attack on international nurses, because I was fortunate to be an international nurse here in the States working. So I totally understand, because a lot of times persons will be saying, "Oh, Stacey, I don't understand what you're saying." So I totally understand this language barrier, but especially in Jamaica, where a lot of time nurses and patients are communicating in the same patois, a lot of times, yes, it's okay on certain days because that's just the culture there. But what about persons coming in and can't explain certain things in patois to the patients? Not saying that that's the, but if you understand what I'm saying. Please go ahead and just leave your comment down below, and let's just discuss it a little bit more. But until then, remember to follow me here on TikTok and subscribe to my YouTube page at ThinkNursing, where I share longer form content, and just be a part of the family. Until then, I'll see you in the next video. Bye.